Hello, I'm Chini from MSK Marai.
Today, we will discuss the overall topic of stump entrapment of the ACL and a specific case of a type 1 stump entrapment. Displacement of a portion of the torn ACL into the intercondylar notch is known as ACL stump entrapment. Due to the impingement, subsequent inflammation, and fibrous tissue deposition, this can result in locking or limitation of knee extension. Interestingly, the histology of many adult ACL stump entrapment lesions is similar to that seen in postoperative cyclops lesions. On MRI, the entrapped ACL stump shows a hypointense to intermediate signal on intermediate weighted sequences and a heterogeneously hypointense to slightly hyperintense signal on T2 weighted images. Diagnosing ACL stump entrapment is essential, as it guides the timing of surgical intervention. Delaying surgery until swelling has resolved and full hyperextension is regained can maximize the chance of restoring the full range of motion postoperatively. However, early surgical debridement may be warranted in patients where the mechanical block will not be resolved with physical therapy alone, as this can improve outcomes of subsequent ACL reconstruction. Interestingly, preservation and trimming of residual ACL stumps may have benefits in terms of proprioception and reinnervation of the ACL graft, particularly in cases of type 2 stump entrapment. Two distinct types of ACL stump entrapment have been described. Type 1 lesions resemble a classic cyclops lesion, a nodular mass at the anterior aspect of the intercondylar notch. In contrast, Type 2 lesions lack the mass-like appearance and instead show the anterior portion of the torn ACL folded upon itself, with a thin, tongue-like free end extending anteriorly out of the notch. It has been theorized that type 1 lesions may develop from chronic impingement and fibrotic changes of an underlying type 2 lesion. In this patient, the MRI findings show a complete tear of the ACL at the mid-substance, with the proximal ACL fibers visualized. However, there is a focal nodular low T2 signal intensity mass seen in the infrapatellar recess, the posterior aspect of Hoffa's fat pad, and the intercondylar notch. Differential considerations for this appearance include displaced meniscal tissue, a loose body, or a localized tenosynovial giant cell tumor, in addition to the initial suspicion of a cyclops lesion or ACL stump entrapment. This represents an entrapped distal ACL stump, a condition known as ACL stump entrapment. ACL stump entrapment occurs when a torn segment of the ACL becomes displaced and trapped within the intercondylar notch, causing knee locking or restricted extension. In this case, the nodular shape and low signal intensity suggest chronic impingement of the ACL stump between the femur and tibia, resulting in fibrotic changes. Therefore, this is diagnosed as a type 1 stump entrapment. Thank you for watching. Please subscribe and like the video. Your support is appreciated.